Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode we're going to be talking about balance exercises that can be used to help improve the side effect that is peripheral neuropathy. So peripheral neuropathy is a side effect of chemotherapy, and typically it will occur in the fingertips or hands and toes or feet of the patient who's suffering this side effect. And it's quite a debilitating side effect because not only can it cause pins and needles, numbness or pain or all of those things in the feet and the hands, but if you've got it in your feet, it can also cause balance problems when you're walking or standing, and this can really impact your daily function. So what I wanted to focus on in this video is some basic balance exercises that you can start with to help improve your balance and therefore improve your mobility if you have peripheral neuropathy. Now, just a few precautionary things I'd like to point out. If your balance is so poor that you're at risk of a fall, then these exercises may need to be done under supervision. Now, that supervision may be a physiotherapist, it might be a doctor, it could be an exercise physiologist, it might be your partner at home or a carer at home, but at least someone who is physically suitable to supervise you and is not going to allow a fall to occur. So this is the most important take-home message of this video, is that if you're going to perform these exercises, the best thing you can do first is make sure that you're assessed by a medical or a health professional who has experience with peripheral neuropathy to deem if you're safe to do these exercises at home. The biggest issue with helping people improve their balance is that we have to put them slightly off balance to improve that balance. And therein lies a problem, in that you are at risk of a fall if you are performing balance exercises. So this video does not substitute the advice that you're going to be getting directly from your doctor or your medical team, but these are general exercises that might help guide you with some ability to improve your balance and mobility for the after effects of peripheral neuropathy. So if you're unsure as to whether you're suitable to do these exercises, then please discuss this with your medical or allied health professionals. If you are feeling unwell, such as already feeling dizzy or lightheaded for whatever reason, it might not be a sensible idea to do these exercises on that particular day. If you end up feeling unsafe doing these exercises, or if you really do feel you're being put at risk of a fall, then please cease these exercises until you're medically cleared. One of the other things that I like people to consider before they start these exercises is whether or not they're going to perform them barefoot or with shoes on. Now, in this video I have used my own joggers that I usually wear when I go walking or bike riding. So these are a really simple pair of supportive shoes, and ideally I think it would be better for some people to consider starting with a supportive pair of shoes, particularly one that's gentle on the base of the foot, because it's often the underside of the foot that seems to get the most affected by peripheral neuropathy if you've got it in your feet. And firm surfaces can also irritate peripheral neuropathy, so also consider what surface you're standing on when you first start these exercises. In this video I'm wearing footwear and I'm performing these exercises on a carpeted floor, and that's probably a much softer version than if you're barefoot on tiles or barefoot on a wooden floor. So just keep that in mind. At the end of the day, it's really what works best for you and what your feet tolerate when performing these exercises. As far as how frequently we should perform these exercises, I would recommend you do these exercises for around 5 minutes each day. Balance is actually something that if you work on it on a frequent basis in short, sweet bursts, it can really be improved quite dramatically over a relatively short period of time. And for the patients who I have who have peripheral neuropathy in their feet, they really do report that these basic balance exercises help them start to be able to move around their environments a little bit easier. Of course, it doesn't take away the symptoms of the pain or the pins and needles or numbness, but it certainly can assist them in how they can balance while they're standing upright or they're walking around. So in this video, we're going to focus on what we coin static balance exercises. So these are exercises that are performed standing still. The second video that I'm going to do on peripheral neuropathy is going to follow up with what we call dynamic balance exercises. And dynamic balance is where you're moving and balancing at the same time. Whenever you're starting out with balance exercises, it's really important to check that you can do the lowest level balance exercises with good control. Now, one of the things that really helps you feel safe and remain safe when you're doing these exercises is to be very close to a stable object. Now, when I say staying close to a stable object, I really do mean within a hand's reach. Because if we are near a stable object but not close enough and you lose your balance and you're trying to regain your balance and you're just not close enough to that stable object, it's no point having the stable object there, because by the time you've started to fall, you're already too far away from it to help regain your balance. So remain quite close to that stable object at all times when you're performing these static balance exercises. Make sure the stable object, of course, is nothing on wheels. So an office chair that is on wheels or casters, anything that's mobile is not considered a stable object. It's also something to consider that the stable object is at a relatively high height, like a dining room table or a kitchen bench, such as an island bench. It might be a heavy dining room chair. So really make sure that a stable object that you're standing close to help support you is actually stable. The other thing I'd really like to show you is that there's no problem if you need to start balance exercises with both hands on the stable object when you first start. There's a lot of wonderfully easy ways you can slowly graduate the difficulty of a balance exercise just with dropping off your base of support in your hands. So what I mean by this is that in this little section of video, I'm going to demonstrate how when I walk up to the stable object, I place both my hands on the bench. And then if I was to progress from both hands, I could drop down to 2 fingers, then I could drop down to 1 finger, then I could drop one hand by my side, I could then drop one hand to 2 fingers, then down to 1 finger, and then I could hover my hand above the bed. Now, my preference, rather than to drop both hands by my side if I'm really getting quite progressive with my balance exercises, rather than drop my hands completely, I prefer to hover my hand over the stable object, because if in the circumstance I did lose my balance momentarily, rather than my hand being right down by my side, which means that I've got to take all that time to get my hand back up to the stable object, my hand is right there ready to touch down and I can regain my balance really quickly. So hover rather than drop your arms by your side. So the first exercise I'm going to demonstrate is standing on one leg. So we're literally going to show this exercise with one hand on the stable object. If you want to, you are more than welcome to face the stable object rather than stand side on, but for the purpose of this video, I'm going to stand side on. And then you make sure you're balanced on 2 feet before you lift one foot up, and you don't necessarily have to lift the foot very high off the ground. So you'll see in this video, I demonstrate that you can pick your foot up off the ground, but it doesn't have to be at a really high height. Again, this is for safety reasons. So if you want to put your foot back down quickly so that you can regain your balance, the distance between your foot and the ground is a lot smaller if you haven't picked it up that high. So that's a little trick for people if they're a bit worried about standing on one leg. Don't pick your foot very far up off the ground so that you're getting that foot back down to the ground quickly if you need to. Make sure, of course, that you switch over to the other side. Also, another little interesting piece of information, whenever you do a balance exercise, it's most likely that if you have to use one foot first, you're most likely going to do your better side. So the side that you're more balanced on, you're most likely going to naturally go to that side. So if all of a sudden you switch feet and you find you're a lot less balanced, that can be a natural asymmetry. And most people have it regardless of whether they've gone through cancer or whether they've had peripheral neuropathy or not. The second exercise I'm going to demonstrate is to place one foot in front of the other. So this is called a tandem stance. Now, some people have difficulty with this exercise because it challenges your lateral balance. So some people will be really good at standing on one leg, but as soon as they put one foot in front of the other, this can be a little bit more difficult. So again, set yourself up as to what you need for balance, whether that's one hand or both hands, 2 fingers, 1 finger, whatever you need, and then you can place one foot in front of the other. Of course, then we want you to switch feet so that the other foot is leading. So whenever you're performing any of these balance exercises, you need to work out what level of support from your hands you need to safely perform the exercise. As you get better doing the exercise, that is going to change, of course, over time. The third exercise we're going to perform actually involves reducing your vision. So just be aware, guys, that when we start to remove vision from balance exercises, this is increasing the degree of difficulty. So I'm going to put my feet together. That reduces my base of support, and that can be an element of this exercise that if putting your feet together is hard enough, then that's one part that you can do by itself. But the other factor is that if when you close your eyes, if it then becomes too difficult to maintain balance, you may want to consider just keeping your feet at hip width apart. So you can either put your feet together and try that as a balance exercise by itself, or you can keep your feet at hip width apart, then close your eyes, and then try the balance exercise as that. So the goal with this exercise is to place your feet side by side, right next to each other. Once you've gained your balance with that foot position, then we close our eyes. One thing I strongly recommend though is whenever you're doing an exercise where your eyes are closed, you want to make sure that you've got at least one fingertip in contact with your stable object. Because unfortunately, when your eyes are closed and your base of support is narrowed, if you start to fall, sometimes you can't actually feel yourself falling through space. That's why I like anybody, even if they've got relatively good balance, to keep at least one fingertip on the stable object as your reference point. You'll get a natural amount of sway when you're doing this exercise, so don't worry if you start to feel a little bit like a drunken sailor when you close your eyes. Natural sway when your vision is removed from a balance exercise is quite normal. The fourth exercise we're going to perform is going up on our toes. Now this is going to be different for each individual, of course, as to how long they might be able to stay up on their toes. So you can take the full range of motion through your ankle and go all the way up onto the top of your toes if you would like to do that and if you're tolerating that. But the other option is to just come a little way off the ground, so lift like a couple of centimeters off the ground with your heel. So whatever works for you is totally fine. You can take a shorter amount of time with your heel off the ground, or you can hold it for quite a long time if that's what you can tolerate. Again, really all we're looking for is in each of these exercises is to just challenge your balance by a little bit. So not put yourself so far outside your comfort zone or out of your safety zone that's going to mean you are going to have a fall, but you just want to do balance exercises that are just challenging you a little bit. And every time you're chipping away and you're just getting a little bit better with each aspect of your balance, that's what's going to help your mobility when it comes to dealing with the side effect that is peripheral neuropathy. The last balance exercise I'm going to show you today is standing on one leg and then closing your eyes. Now this is the most difficult exercise of all of the exercises I've shown in this video. Yes, it's still a static balance exercise, but if you have struggled with any of the exercises prior to this one, this may be one that you do once you've gained a little bit of confidence and gained some improvements in your balance before taking this one on. So in the video, I will stand on one leg, making sure that I've already gained my hand position on the bench. And like I've said in the other exercises, make sure it's to what you are comfortable and safe with. So it might be 2 hands rather than 1, but for the purpose of this video, I'm just going to face the camera with one hand on the bench. Then once you're stable, standing on one leg with your hand or hands on your stable object, then you can close your eyes. And how long you close your eyes for, of course, is up to you. It might be 3 seconds or it might be 30 seconds. It's whatever is going to challenge your balance and make your balance get a little bit better by doing this movement. Once you've put your foot down, open your eyes, switch over to the other leg. Make sure you have got good balance before then closing your eyes again once you've switched legs. Thank you so much for watching this video, guys. I hope you've gained some great information on how to perform static balance exercises for peripheral neuropathy. If you have any questions on how to perform these balance exercises, or if you're not sure whether you should be performing them, then please leave a comment in the section below. But the take-home message with this video, as I said at the start, is to get medically cleared to perform these exercises if you're not sure whether you're competent to do these at home. And if you need to, make sure you've got a supervising health professional or carer at home that is competent to be able to supervise you so that you can work on your balance when it comes to peripheral neuropathy. I'm Jen McKenzie, the breast cancer physio, and I'll see you next time.